Good evening, everyone. My name is Nicole Petrin, and I am here today to represent Unite New Hampshire and the new programming that we're bringing to the state. So a little bit of background. The state of New Hampshire is comprised of roughly 1 million people. So with the population being over 1 million people, there are currently 26 acute care hospitals in the state. Those hospitals treat individuals for physical health conditions, ailments, surgeries, things of that nature. And to the 1 million people within our population, there's only one psychiatric hospital in the state, otherwise known as New Hampshire Hospital. So in 2005, there were over 500 patient beds for psychiatric care in our state. And to date, in 2017, those numbers have been slashed drastically. There's currently 160 patient beds for psychiatric care across the state. So who is affected by all these changing and decreasing of services? Youth and adults, as both youth and adults experience various symptomology of mental illness. The age range, both of them are affected. Caregivers, whether an individual is under the age of 18 or over, caregivers are often involved in the treatment of mental health and services being utilized. So caregivers are equally affected when they're watching their loved one not receive the appropriate care. So to put it into perspective, in the March 2017 report, the wait list for residential care, or otherwise the waiting list for a space at New Hampshire Hospital, on one day, the wait list was more than 60 patients. And in this also March 2017 report, the wait list for community-based support, such as individual counseling, the average wait time was 2 months. So we have a need here. We need to expand existing services. Currently, New Hampshire has 10 community mental health centers, all located across the state based on region. So we need to expand the outpatient services within these community mental health centers. That means hiring new clinicians. So hiring new clinicians to provide those services at the community level, and mobile crisis teams. These are trained professionals to go out into the community and assess a person who's experiencing a psychiatric emergency. The mobile crisis team assesses and determines if the person needs hospitalization or can maintain in the community. We need to introduce new programming. New Hampshire Hospital is the only residential program with psychiatric services for inpatient. So we need to make sure that these 10 community mental health centers also receive the programming they need for residential services. Their residential services at the community mental health centers can accommodate youth and adults. So the vision. It's important to note here that Unite New Hampshire will be governed by the Department of Health and Human Services, Bureau of Mental Health. So with this statewide approach, we envision a statewide mental health system that is accessible and inclusive to all individuals. Accessible meaning that individuals will be able to access care regardless of their ability to pay or insurance. And inclusive, we're going to make sure that individuals are able to access care regardless of their symptomology, whether their needs are high or minimal. We're going to make sure that there's inclusion for all. Our mission. We recognize that mental health is as important as physical health. So we're closing in the gap on these services that are currently lacking in the state. What we plan to do. We're going to decrease the waiting period for residential services by 80% within the first year of operation. We're going to have a 50% decrease in waiting periods for community-based care, also within the first year of operation. And lastly, we're going to maintain individuals' treatment closer to their home. New Hampshire Hospital only has one location in the state, which is in Concord. It's not centralized to the entire state, and therefore individuals can travel up to 100 miles. These community mental health centers are going to be based on region still, which means individuals can access care closer to home. So Angela Blanchard once said, "You can't build unbroken." And we're doing just that. We're taking what we have in New Hampshire, the 10 community mental health centers, and expanding them. We're going to use participatory research. We're going to be asking the community, the stakeholders, what it is we can do to help develop the programs needed. We're going to use focus groups. We're going to use these focus groups to, again, gather the information we need and elicit the support from those involved. And community forums. Though it's a larger scale, we're going to be using these, again, to gain the input from individuals. So to measure our success, quality of care. Both client and caregiver surveys are going to be distributed to clients at the discharge of services. These are anonymous and electronic and can help us understand what it is their quality of care is lacking or where we're doing well. And to measure our outcomes, taking the historic statewide data regarding waitlist and comparing them to the more accurate and recent data at the community mental health centers, this will help us track to the waiting periods that we're looking to decrease. So this is what we have for Unite New Hampshire so far. What kinds of questions do you have for me?